स्वास्थ्य खबरको विशेष प्रस्तुति स्वास्थ्य संवादको 23औं एपिसोडमा यहाँलाई हार्दिक स्वागत छ। म डाक्टर सुभाष प्याकुरेल। आजको कार्यक्रममा हामीसँग विशेष अतिथिको रूपमा एउटा विशेष दम्पति हुनुहुन्छ, जिम साइमन्स एन्ड मार्लिन साइमन्स। जिम साइमन्स उहाँको धेरै परिचय छ। उहाँ गणितज्ञ हुनुहुन्छ, उहाँ अनुसन्धानकर्ता, व्यवसायी र समाजसेवी हुनुहुन्छ। फोर्ब्स पत्रिका अनुसार 20 बिलियन डलरका धनी, उहाँ धनको धनी भन्दा पनि अझ बढी मनको धनी हुनुहुन्छ। खास गरेर निक साइमन्स इन्स्टिच्युट मार्फत नेपालको जिल्ला अस्पतालको स्तरोन्नति र ह्युमन रिसोर्स एमडिजिपी डाक्टर सहितको टिम पठाएर त्यहाँको सुदृढीकरणमा उहाँको विशिष्ट भूमिका रहेको छ। We'd like to welcome to this show Jim and Marlene.
Thank you.
First, I'd like to start with Jim. Why you love Nepal very much?
Well, we've come to love Nepal very much. As you know, we lost a son, our son Nick, who had been working in Nepal, and he liked the country very much, and he was also interested subsequently of perhaps going to medical school. He was interested in health.
Okay.
So when he passed away, in thinking of what we might do in his memory, to do something here in Nepal seemed like a good idea. Gradually, as we've gotten to know various people in Nepal, we've made friends here, and have come to really love the country.
Well, my question goes to Marlene. Nick Simons Institute is really doing good job for our country. So is there any particular reason that you have chosen service sector as health care and particularly rural health care of our country?
Well, I have two answers to your question. First, why Nepal?
Yeah.
And the reason there is because our son had lived here and worked here, and we visited him when he was here, and we had such a wonderful time.
Okay.
So it really brought back a really happy time in our lives, the wonderful experience that we had. And medical, because we knew that our son was thinking about a career in medicine, and you always want to see your children's dreams come true. And even though he couldn't be here, it was by getting involved with health in Nepal, it was a way of realizing those dreams.
Okay. In fact, the program you've been offering to strengthen the district hospital system through the access of government system, like hospital management strengthening program and rural staff support program, is doing good. Apart from that, have you been thinking to add some more avenues in health sector for our country?
Well, primarily we're working through NSI. When we first came to look around and see what we might do before NSI began, we met the head of Patna Hospital and thought we might begin with doing something for that hospital. So we built a wing for the hospital, but that was a one-off, so to speak. Gradually, we asked some people what else might we do, in particular in rural health. And Mark Zimmerman, who actually headed Patna Hospital at that time, suggested health training, mid-level health training, was the best thing we could do for the rural community. And so NSI began on that basis. We weren't thinking of the staff support for district hospitals at that point. We were just thinking of training mid-level health workers. then gradually it expanded.
Okay. So what's your observation, Marlene, regarding input versus output? Is the program doing well? What's your observation, or you want to add some more?
Well, I think that we've had a good start. It's been great working. We started with a few districts, and over time we've been adding more. So presently we're involved in 18 districts and hoping to expand. But so I guess that's an indication that we're feeling very positive. We'd like to help each district hospital improve its standards in the hospital and strengthen its delivery of care. You know, to your question to Jim, if I could just add, we, decided to focus our efforts on strengthening healthcare in the rural areas. And from time to time, we certainly take a broad view of how could we further support medical care in Nepal. But I think that there's a lot to do in the rural areas, but it's been a very productive working relationship, and we'll continue to build.
Okay.
The trainings, we continue to do the trainings, and they've broadened as well. We trained biomedical engineers to fix equipment, which is one of my favorite trainings, because there's so much broken equipment that's maybe donated, and then it's just lying there, and it costs $50,000, and it needs a half a day of work, and it will be back in action. So we train that. We developed the training for anesthesia assistants, because most rural hospitals certainly aren't going to have an anesthesiologist out there, but a person with 1 year's training can do most things that an anesthesiologist does, and therefore these posts are very valuable. We created that post, and SI created that post. So gradually the trainings have broadened, and now for the last several years the district hospital program has been growing. So the program has been growing in different areas.
It was very nice to see. Last couple of weeks back, our team was in the Bajang District Hospital. We were pretty happy to see the surgery going on for supracondylar fracture at the time of 8:15. The operation theater was operational in true sense, so it's pretty doing good. So my question would be that, like, Nepal is on the verge of restructuring the system. It has gone into the 3 different layers. So at this point of time, what would be your suggestion or input to our policymakers, professionals, or even public?
Well, I was frankly very dubious with going to this federal system. I thought it's a small country to begin with. Why break it up into 7 smaller districts or provinces? But in any event, they're doing that. And the advantage could be that the provinces would be better able, because they're closer to the scene, to oversee the health care that's being delivered in that particular area, or some of the district hospitals in that province might get more attention than they would from a central source. But this is very early days. You're just starting with this system, and we'll have to see how it works. Marilyn, do you have any comments?
No, I think we're waiting to see how the system is rolled out and understand how we could best work within it.
Okay. Marlene, what's the objective of this kind of rural health conference and for the next 3 days?
Well, I think it's to enhance the skills of the rural health workers,
Okay.
but very importantly, to bring people together. They're working often isolated from their peers.
Okay.
When you bring people together, they can share experiences, they can feel a sense of camaraderie, build a community that I think that will make them strengthen
Okay.
the way they feel about the jobs they're doing, the impact they are having. They're not one person, they are a whole community that's bringing about change.
Okay.
So I think that's a really important outcome for this conference.
Yeah, and it makes the participants feel important. I think, is this the fourth year? I'm not sure what year it is, the
That's
fourth year.
actually
It's
the
ninth one, yeah.
Oh, the
Yes.
ninth one, okay. Well, then, okay, we've been having them for a long time. But they seem to be a good success.
Okay.
And it's, it's mid-level people mostly who come to this. And this makes them feel important. And as Marilyn said, of course, there's camaraderie and learning from each other. So it seems to be a very good conference.
And can I just
Yeah.
add
Yeah,
also about how important they are, not just feel important, but they are important.
Yeah.
Being an MDGP, you have so many skills, and I think that we want to recognize the terrific contribution that these people are making within the medical system. Oftentimes it's great to be a specialist,
Okay.
but to be a general practicing physician, you have to be good in everything.
Okay.
So that's one reason why we want to recognize their efforts.
Okay. Zim, my last question would be, is there any expectation from our government or from our public side to Nick Simons Institute so that it can do much better?
Ask that question again. Is there any what?
Is there any additional support from,
From the
the government side to Nick Simons Institute so that the program goes much better?
Well, we determined in the very beginning to be cooperative with the government and work together with the government rather than swooping in and saying, okay, we're going to do it better and we'll do it ourselves and so on. So it's been, from the very beginning, a cooperative effort. And I think, sure, there are things that the government could do to make this better. I think they may be in the process of amplifying the district hospital program. We're only covering 18. There are now about 80 or 83 district hospitals. If the government gets involved, as I think they will, we'll be able to cover 30, 40 of these hospitals rather than just 18 or 20. So, but it's been, I wouldn't say a pleasure, but very satisfying to work with the government. In the case of MDGPs, I believe we were the ones who pushed the government to make more of these and hire more MDGPs in the government service because we could see the importance, and the government realized, yeah, they should do that. So it's a two-way street.
Okay. Martin, you wanted to add something?
Well, I was just going to maybe elaborate on our intention being to really complement what the government is doing. When you ask what's our expectation from the government, or when Jim said the government's involvement, I think we're just referring to working as partners with the government, getting a memorandum of understanding that we will try to amplify their efforts and top off or, come in where, we could further support what the government is doing. So we're not asking the government for anything except for the opportunity to work with
Okay.
it and help develop terrific people.
Okay. Is there any special message to Nepalese people from your side?
Well, we certainly hope that the political situation can stabilize a little bit. We're hoping that this time the Prime Minister lasts for a good length of time. I think this country really needs stability.
Okay.
And hopefully, now that the Constitution is drawn and all this period has passed, Nepal can enter into a period of more stability, which I think will be great for its economy.
Special gratitude for your special time for us. Thank you.
Okay.